As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encountered kind, healing souls along the way. But just when we thought we had it tough, COVID-19 made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccine acceptance.
Never in our history has there been a more urgent call to stand united, get vaccinated, so together we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
When it comes to how many kids Filipino couples want to have and how many kids they end up having, meron tayong nakikitang pattern. Parents usually end up with one child more than what they initially wanted. At ang pinakamahihirap na pamilya, sumusobra pa sila ng dalawa. Pag mas malaki ang pamilya, mas lumalaki rin ang posibilidad na maging mahirap ang pamilya. Poverty leads to children growing up not reaching their full growth and productivity potential. Responsible parenthood and family planning is one of the 3 program components of the Philippine Population Management Program. Tugon ito sa pangangailangan para sa epektibong pagpaplano ng pamilya. RPFP has 3 goals: 0 unmet need for modern family planning, pataasin ang paggamit ng modern contraceptives to 65%, at maiwasan ang di inaasahang pagbubuntis, lalong-lalo na para sa mga mahihirap na kababaihan. Sa RPFP, matutulungan ang mga couples na ma-achieve ang tamang pag-aagot ng pagbubuntis at ang bilang ng gusto nilang maging anak na kayang bigyan ng maayos na tahanan at kinabukasan. Paiigtingin ng kampanya para maipatupad ang Responsible Parenthood and Reproductive Health Law at Executive Order No. 12 sa mga lokal na pamahalaan. We'll use communication campaigns to promote responsible parenthood and family planning, natural man o artificial methods upang tumaas ang demand para rito, especially among poor women and families. Ilalapit natin ang reproductive health services at contraceptive commodities sa mga mahihirap na komunidad para ma-access ng sino mang gustong magplano ng pamilya ang family planning method na hiyang sa kanila. With the Responsible Parenthood and Family Planning Program of the Philippine Population Management Program, we'll make sure that couples and individuals have the knowledge and support they need to start the family of their dreams. Empowering Filipino families.
Labanan ng COVID-19, ang kailangan natin ay tama at totoong impormasyon, hindi fake news. Huwag ka agad maniniwala sa nababasa at naririnig. Ang pagkalat ng mga maling paniniwala tungkol sa COVID-19 ay nagdudulot ng panik, takot at maling desisyon. Laging i-double check kung saan nanggaling ang nabasa o narinig. Maging mapanuri at i-share lamang ang tamang impormasyon. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Kumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
B-I-D-A. Be the solusyon sa COVID-19.
Magandang gabi po sa inyong lahat. Ito po ang Alaga Health Live. And today, we are celebrating, in advance, a day early, World Population Day 2021. And of course, ang ating Alaga Health Live ay hindi makukumpleto kapag hindi natin kasama ang ating mga special guest medical professionals. And of course, our advocacy champions as well. So to kick things off, coming back as part of the regular cast of Alaga Health Live, the one, the only, our resident celebrity psychiatrist, Doc Joan Perez-Rifareal. Good evening, Doc.
Dr. Dex. Good evening, everyone. Thank you very much for inviting me once again, Dr. Dex. Maraming salamat po. And yes, we are celebrating World Population Day tomorrow. So thank you very much for having me.
Yeah, thank you very much, Doc. It's always a pleasure to have you, lalong-lalo na that every week, lagi may katanong about mental health. And actually, we have some questions already lined up. But joining me Joining Doc Joan today, of course, is Alaga Health's resident primary care physician, none other than Doc Via Roderos.
Hello! Once again, good evening po sa ating mga viewers and of course to our very beautiful Doc Joan who is always with us every week. No? Hi Doc Joan! It's so good to see you. You look so blooming. And sa lahat po ng nagsiselebrate ng World Population Day, sa lahat po ng mga pamilya, sa nanay, tatay, ate, kuya na nanonood sa atin, magandang gabi po. Sana marami naman po tayong matututunan ngayong gabi.
Perfect. Thank you, Doc V. And of course, actually, she's just having a little bit of technical issues, but we will be joined by the fabulous and amazing, ever nice Doc Florentina Titit Villanueva. And hindi makukumpleto ang Alaga Health Live kapag wala tayong advocacy champions. And since this is World Population Day that we're talking about, who else better to join us than representatives, champions from the Commission on Population and Development, or POPCOM, and we're very lucky that he is back, coming off from a very hotly received episode during Father's Day, returning to Alaga Health Live, none other than Deputy Executive Director of the Commission on Population and Development, Director Lolito Tacardon, or Boyet Tacardon. Good evening, sir.
Hi, masayang pamilya sa ating lahat. Magandang gabi. And also to Doc Joan and Doc Dia, and of course kay Doc Dex. Nice to see you once more. Nice.
All right.
Thank you.
It's always a pleasure to have this wonderful team with us. It's always very great na marami tayong viewers ngayon. So if you have questions about mental health, reproductive health, or anything under the sun, hopefully masagot po natin yan during our 1-hour free consultation session. But to kick things off, I think it might be time for us to get a very wonderful message, a quick message regarding World Population Day by our big kahuna from the Commission on Population and Development, none other than Yusek Juan Antonio Perez. It's time for Alaga Health.
Magandang gabi sa inyong lahat. Isang pagbati kay Commissioner Dexter Galban, mga resource speakers dito sa Alaga Health. This week we are celebrating World Population Day, which is focused on dynamic demographics, no? And its impact on the sustainability of sexual reproductive health and rights sa panahon ng pandemic. We all know that at the start of the pandemic last year, we were very concerned about the impact of the COVID emergency on family planning services. And we called for local governments, civil society, and our partners to do things differently, to go house to house, to use other forms of communication, and since we did not have any more classes, to start having virtual sessions with our target audiences and populations. Last year, we were afraid that we would have an increase in population this year because of the increase in unplanned pregnancies due to the failure of family planning services. But we have seen that in 2020, rather than going down, family planning services increased nationwide by 4%. Today, we know that we have 8.1 million women and couples, individuals, using modern family planning methods in this country. It is the highest that we have seen family planning in this country. And because of that, our modern contraceptive prevalence rate at the end of 2020 stood at 59.47. However, there is also a concern in the middle of the pandemic. Despite the improvement in family planning, we are still seeing increases in maternal mortality. Rather than a baby boom of 700,000, we may also see an increase in maternal mortality of up to 600 this year and from the previous year, from 2020. So that will be an increase of 50% in maternal mortality. Those are the concerns that we should be addressing in sessions such as this in Alaga Health. World Population Day asks us to focus on dynamic demographics and that we should sustain family planning services, sexual reproductive health and rights, so that we can maintain our path towards the demographic dividend that this country has aimed for and which we hope to achieve by 2025. Our vision is still clear. We can overcome this COVID and we can reach the demographic dividend, the barriers notwithstanding. So I welcome sessions such as this, and I congratulate again Alaga Health, Commissioner Dexter, and everyone here for participating in this webinar. Mabuhay kayong lahat. Kaya natin ang COVID.
Yeah, naman, that is the message of USEC Juan Antonio Perez or Doc GP Perez. And of course, POPCOM is always there to champion the welfare of the Filipino family. Sa amin sa POPCOM, panalo ang planado. So to kick things off, probably we are very curious, no? What is World Population Day all about? And in terms of health, ano yung mga pwede natin siguro bigyan ng pansin ngayon? Probably we can start with DED Boy.
Hi, magandang gabi ulit. No, annually, every year we celebrate it on July 11, yung World Population Day. We observe that na event that emanated kasi during the time when the world population reached 5 billion in 1987. So since then, we observe yung World Population Day among members of the United Nations as mandated by the General Assembly. And noong 2011, actually, the world reached the 7 billion mark ng population natin. Tayo sa Pilipinas, we reached the 100 million mark in the 2015. And then now, as of latest data, we are now 7.7 billion sa buong mundo, no? So ganun na kadami, and by 2030 we are expected that will be 8.5 billion, no? So ganun kalaki na yung ating populasyon sa buong mundo. And just recently the PSA actually released na yung latest census natin ng 2020, and we are now 109 million Filipinos, no? So imagine nyo, talagang pataas pa rin ng pataas yung ating population. That's why for this 2021 observance of the World Population Day, ang focus niya is within the shifting fertility or demographic dynamics na nabanggit ni Dr. JP kanina. The message is to put within that context at its center the provision of sexual and reproductive health and rights. So that means within the context of the pandemic, dapat ang gobyerno, the state should also be able to provide yung access lalo na sa family planning and other reproductive health services, which was affected really by the various community quarantines, lalo na yung in terms of the mobility of women and couples to access that in public health services. So yun yung ating sentro ng celebration ngayon, calling upon all institutions to ensure that women are able to access pa rin mga family planning and reproductive health services within the context of the changing demographic structure, as well as within the context of the pandemic.
Yon, thank you very much, DED Boyd. No? Ang ganda kasi very holistic yung approach to population management and development. And since we're talking about the population, little known fact that when we talk about this endeavor of POPCOM, hindi lang talaga siya focused on a particular advocacy. It encompasses so many things, even mental health, gender, among many things, no? And of course, nahagip dyan yung issues on mental health. And actually, mayroon na tayong question kaagad. from one of our viewers here, from Ma'am Rodelyn Fernandez. Ma'am, you can say hi sa comment section, no? Sasagutin na ito ni Doc Joan. Kasi dalawa yung concerns niya. Baka pwede pagtulungan ni Doc Joan tsaka ni Doc Via. Kasi dalawa. Una, ask daw niya kung bakit parang minsan nakakaramdaw daw siya ng kaba. No? Lagi siya nakakaramdam ng kaba. Then pangalawa, parang hirap siyang huminga, lalo na kapag nakahiga at nakatagilid. Paminsan, pagkatapos din niyang kumain, o kaya parang may nakabara din sa lalamunan o parang dumadaloy sa bituka. Ano daw ba yung dapat gawin? So parang dalawang concerns or isa lang ba to? Anong approach natin dito, Doc Joan and Doc Via? Sige, si Doc Joan muna siguro. Dun sa kaba ni
Yes. Oh, yes. Thank you very much, ma'am, for that question. May mga missing info lang doon, Dr. Dex, no? Like how old, anong age na ni ma'am, anong ginagawa niya ngayon sa buhay, anong estado. So mas maganda pa rin po yung complete holistic, no, complete assessment and evaluation kasi kailangan natin malaman na hindi ang yung kaba ay hindi due to medical factors, no? So marami po kasing mga medical factors ang nagko-cause ng kaba. So it can be heart problem, metabolic, systemic. So marami pong pwede or cardiac problem. So maraming pwedeng titingnan, no, i-rule out po ma'am na sakit bago natin masabi na it's a purely or primary anxiety or psychiatric concern po. So mas maganda po holistic evaluation po lagi. Kung na-evaluate naman po, no, just in case lang paunahan ko na, kung na-evaluate naman, it's really not medical, hindi siya medically related kasi kung na-check na lahat, no, yung state, no, ng PE and all of the organ systems are clear. Of course, understandable, no, ang anxiety natin ngayon. We are really at risk for mga anxiety symptoms sa panahon ngayon during this pandemic because of the uncertainty of the times. Uncertainty, meaning marami tayong mga hindi napaplan, no? Hindi natin alam kung ano magiging outcome nitong pandemic. It's marami ang beyond our control at this point. So pag nawawala kasi yung sense of control natin, nag-a-add yun, no, sa mga pangamba, takot, worry natin to the point na nag-iisip na tayo na anong mangyayari tomorrow, next week, in the coming months, lalo na kung may pamilya tayo. So worry about health natin, especially with the ongoing, no, na different strains, bagong strains, economics, no, the economy of the country. It's a global health and financial crisis ngayon. And of course po, no, pag tayo ay physically distant tayo sa ating mga kamag-anak or kaibigan, nakaka-add yun sa lungkot, sa isolation, that feeling of loneliness, no, which can also increase that risk for having anxiety symptoms po. So I hope na na-answer ko po yun, ma'am.
Thank you very much for that, no? Ang ganda kasi nasagot yung main first concern. Pero may part 2 daw yung question niya. Maybe Doc Via can swoop in para daw, pag nakahiga siya at nakatagilid, parang hirap at may nakabara sa kanyang dibdib. Tapos parang may something daw sa bituka. Anong response natin dito, Doc Via?
Alright, no? Ang daming symptoms ng ating viewer, no? And actually, a lot of that can be attributed to different systems as well, no? If you can see hirap huminga, no, habang nakahiga, that can be pwedeng, number 1, cardiovascular again, yung tinatawag nating early symptoms of heart failure, no? Kasi minsan, pag nakahiga tayo, may tendency, especially kung yung hindi tayo nakahiga na yung mataas yung una natin, hindi natin kayang naka-flat, that can actually be one of the signs, no? Or pwede rin kasi na that can be gastro, o di ba? Pwedeng kahit hirap sa paghinga, may kinalaman pa rin yung ating tiyan, no, yung ating bituka doon, no? Which is more likely, no? Kasi parang sabi nga ng ating viewer, no, may nakabara daw sa bituka, no? So, kailangan natin siyang tanungin, ano ba yung pakiramdam na nakabara? Masakit ba? Saan banda yung nakabara? And tuwing kailan nararamdaman yung parang nababara? May mga trigger ba? May mga kinakain ba siya na nagtitrigger ng ganong pakiramdam? No? So those are the questions that we need to ask before we are going to give intervention. No? Kasi sabi ko nga, yung mga symptoms po na yan, maaaring galing sa gastro, pwedeng cardio. We need to have more extensive investigation as to how we are going to approach it. But one of the most common things that we see, no, especially dun sa ating mga nanay, tatay, mga ates natin, no, we have symptoms of gastroesophageal reflux disease o yung GERD, no, na minsan nakikita natin na hirap rin sa paghinga pero hindi siya problem sa heart or hindi siya problem sa baga. So kailangan po na magpa-consult tayo para po malaman po natin kung ano po, kung paano natin gagawin o paano natin mabigyan ng lunas ang inyong karamdaman.
Yon, perfect, Doc V, no? So, kay Ma'am Rodeline, sana nasagot namin yung mga tanong nyo, no? More so yung napakahalagang tandaan na minsan yung mga sintomas, hindi ibig sabihin nasa dibdib, sakit ka agad sa puso, o kaya naman masakit yung ulo, automatic neuro, o kaya naman ay iba pang mga bagay. So, it's very good to ask and consult with your doctor. Kaya nandiyan ang Alaga Health. You can even register as an Alaga Health patient sa www.alagahealth.com/registration.html or just simply alagahealth.com. I'll show you how to do that in just a while. But it looks like we can now introduce our guest for today, our OBGYN, no? Our fabulous and amazing Doc Florentina Titit Villanueva. And she's joining us here in Alaga Health Live. Good evening, Doc Titit.
Good evening, everyone. So I'm really happy to be here. Via, salamat sa invitation.
Thank you very much, Doc Titit. It's always a pleasure to have medical experts sharing their time to help out all of our viewers every Alaga Health Live. Actually, Doc, perfect yung pagdating nyo kasi meron ng question for you. No, actually quite a lot because today we are celebrating World Population Day. So talagang reproductive health and sexual health ang ating top priority. So we have one, and this one, Doc, talagang ikaw yung ina-address niya. Nag-send siya ng message through the Alaga Health message button and the inbox. And this is from Ma'am Josie Arsenal. So, hi Ma'am Josie, I hope you are watching. Ito na for Doc Titit. Sabi niya, Doktora Titit, good morning. Actually, nung umaga niya ito pinadala. Meron po akong problema sa sarili ko. Pag umiihi ako, maya-maya mag-iiba daw yung amoy at matagal daw nang napapansin ito. At parang hindi niya agad mailabas. At pakiramdam niya, maya-maya yung pag-ihi niya. Feeling daw niya, ang concern niya ay reproductive health. So, ano thoughts niyo po dito, Doc Titit?
Okay, yung symptoms na sinasabi ni Ma'am Josie, very, very specific sa lower part ng babae. We have to understand na in the pelvis, tatlong daluyan ang magkakalapit. No? Yung daluyan ng ihi, yung vagina, at saka yung daluyan ng dumi, yung anus o yung rectum. So, yung symptoms ng pag-ihi na sinasabi niya, di ba, parang hirap siyang ilabas or may amoy yung ihi. Hindi lang sa urinary tract ang kailangan natin isipin. Kailangan rin natin isipin yung mga ibang daluyan na sinabi ko na kanina. So very, very common sa babae ang urinary tract infection. I think we already know this because of the anatomy. Magkakalapit nga. So Ma'am Josie, siguro ang una natin kailangan hanapin would be a possibility of UTI. So kailangan po siguro ng urinalysis. Tapos kailangan ko siguro sabihin na sa lahat ng kababaihan. Kasi kung minsan ang request ng doktor urinalysis, hindi naman napapaliwanag na ang proper way of collecting ng ihi is yung kalagitnaan po. Okay? Ibig sabihin, ihi muna kayo ng konti, yung gitnang ihi ang isasubmit niya sa laboratory. Kasi kung yung unang ihi ang kinuha, marami pang bacteria na makukuha doon. So parang hindi na siya ganun ka-accurate. Okay, so that's one. Isang tip yon mga kasamahan po sa Alaga Health. When a urinalysis has to be done, ang tawag po ng doktor midstream catch or kalagitnaang ihi. Number 2, kailangan ko rin malaman po, maliban doon sa pag-ihi, other symptoms like meron po bang discharge. Kasi yung mabahong ihi, baka related rin po yan sa mga vaginitis, sa mga cervicitis. So ang tatanong po ng isang OB/GYN sa inyo is, kumusta po ang discharge nyo? Meron po bang kulay? Ang normal, puti. Pero pag naging yellow, green, brown, red, hindi na po siya tama. No, hindi na tama. Hindi na siya normal. And then the next thing also is the smell of the discharge. So as you see, ang tinatanong niyo po sa akin ay yung mabahong pag-ihi, but meron po kasi ibang possibilities. And then, bakit natin kailangan isama rin sa usapan yung anus at saka yung rectum? Kasi po, yung bacteria na nagkakos po ng UTI at nagkakos rin po ng other vaginitis comes from the anus, which is the E. coli. So, yun. So, siguro po, to wrap up, yung question, yung answer to your question, ma'am, siguro better if you have a urinalysis done. Again, as I said, midstream. Number 2 po, pagpunta po ninyo sa inyong OBGYN, better na i-assess po niyo mabuti kung meron po kayong vaginitis or cervicitis. And that is done through a speculum exam, a pap smear, or a gram stain. Yun. So, wag po baliwalain, ma'am. Kasi kung UTI man po yan, ang UTI can ascend. Pwedeng umakyat po hanggang kidneys. So, may mga complication din po. Kaya, again, please go and have a urinalysis done. And then, please consult already the nearest OBGYN to your place. Okay ba yun?
Thank you very much, Doc Titit. It's always a pleasure to hear your advice to our patients, no? And actually, meron pa tayong mga pumapasok na questions. But before that, segue lang tayo ng mabilis to have a very quick Alaga Health update. Yan. Thank you for that, no? And for liking our show thus far, at kung natutuwa kayo dun sa ating mga narinig na mga advice, I'll actually show you how easy it is to become a part of the Alaga Health family. So, I'll show you here, right now. Okay, so if you can go to our website, www.alagahealth.com, this is what you're going to see. So, maganda pa yung animation. Pinagtulungan po yan ng Alaga Health team, no? So, this is Alaga Health, the Philippines' first digital health marketplace and health service hub. Yan, kita niyo po. And then when you go to the website, you can actually browse some of the content, na look at all of our partners, some of the key facts, why we're doing this for all of you. And of course, how you can connect with us, kung saan po kami na-feature. And balik tayo. Pakita ko sa inyo, when you land sa website, all you have to do is click this button here, nakalagay sign up. So this will direct you to the sign-up page of Alaga Health. In just a few clicks, you'll be already a part of the Alaga Health family. So, kunyari pasyente ka, and you want to become a registered user, pipilitin mo tong For Everyone, patient app. No? Or kung ikaw naman ay health professional, doctor, nurse, medtech, or psychometrician, psychologist, here ka sa health workers. Pero kung ikaw naman ay kunyari merong clinic, kaya laboratory, admin ka, you can click admin app. So, for example, pasyentes, kagaya niyan kanina, so sila Ma'am Rodalyn, tsaka si Ma'am Josie. They can click here, no? And then they can just click continue. Then they'll just scroll through this. Yan. And then, of course, you have to read part ng data privacy natin. Yan. Then just fill in your details, all of this, no? And set up your password to keep it secure. And then all you have to do is press this one. And after that, you're ready to go. So, ganun lang kadali na mag-register for Alaga Health. And ang maganda dito, once you're part of the Alaga Health family, you'll be able to reach out to our doctors anytime, anywhere, every way Basta may available silang schedule, so pwede yon telemedicine, pwede yung home care, pupunta sila sa bahay ninyo, o kaya naman, you can also schedule tests. Yung mga RT-PCR, pwedeng pupunta sa bahay niyo o pupunta kayo sa clinic. O kaya naman, kung ayaw niyo nang pumila sa hospital, at gusto niyo na saktong pagpunta niyo na nandun na kaagad si Doc at kayo na kaagad, you can actually preset your appointment with your doctors. Ganun lang kadali. So, what are you waiting for? Check out Alaga Health right now and register as a patient or even as a health professional. So, that's all for Alaga Health Checkup. Balik tayo ngayon to our questions. So, since World Population Day nga ulit tayo, ang focus natin ay pagdating sa family planning. And, yan, nakikita natin yung mga responses. Sumasagot din si Ma'am Josie sa comment section natin. It's very nice, no? So, balik tayo dun sa tanong natin. May nagtanong kasi si Sir Alvin Hernandez naman, para po sa asawa ko, ano po ba ang pinakamainam na family planning method? Nako, mukhang magandang combo answer dito. We have DED Boyet from the Commission on Population, and of course, we have our OBGYN here, Doc Titit. So siguro, let's start with DED Boyet. Meron po bang pinupush or china-champion na specific family planning method ang POPCOM?
Yeah, actually meron tayong wide range of available family planning methods sa ating mga public health facilities na pwede nilang i-avail. From lahat to ay mga modern types of family planning methods, from artificial up to the natural means of family planning. At ang pinakamahalaga kasi rito, when it comes to sa usapin ng kung ano pa yung pinakamabisa talagang family planning, that would entail for you to go to consult yung physician mo talaga para makita yung tinatawag na hiyang sa iyo. Kasi effectiveness ng isang family planning actually ay nakadepende sa iyong kalagayan. Kaya napakahalaga na before you avail of family planning services ay kumukonsulta ka ng isang eksperto yung sa health service provider para magabayan at eventually ikaw pa rin naman ang magdesisyon. It's just that you will be provided with the widest range of information about the specific family planning methods so that you will know kung ano yung gusto mo, and eventually makapili kayong mag-asawa. And I think sa family planning din, bilang sa advocacy part, yung shared decision din yung ating ipinopromote dito. But in terms of the medical component nito, I'm very fortunate na nandito yung mga doktor magpapaliwanag kung ano yung pinaka mga medical nito. But sa part in terms of advocacy, ang sinasabi natin there's a lot of family planning methods from which they can choose, and it's really very important that they go to their health facility and service providers to be able for them to identify which is fitted for their health condition.
Yon, perfect. Thank you, DED Boyd. Kailangan daw siguro ng medical assistance ni DED Boyd para siguro mas ma-explain pa natin. Ang kakaiba kasi lalaki yung nagtatanong for the benefit of his partner. So, ang ganda naman ng initiative ni Sir Alvin. So, any thoughts, Doc Titit?
I'm really happy na yung husband nang nagtanong. Kasi a lot of times when the patient comes into the clinic, babae yung kausap mo, and then you don't get the thoughts of the husband, which I think is very important. So I agree with our POPCOM chief that importante kasi yung conversation between the husband and the wife, and the decision has to be their decision. Hindi decision ng babae, hindi decision ng asawa, ng lalaki, kundi decision talaga ng silang dalawa na pag-usapan, at saka nag-research sana sila. So that's the first one. So the second one also is, the second thing to remember is also autonomy. So one, commitment. Number two, they decide on it. And then number three, they commit to that method. So maraming methods. It depends on the need. Kasi may tinatawag na short acting. Yung halimbawa, gusto mo lang na hindi mabuntis for let's say a year. Or baka naman yung iba gusto 3 years, meron ding sinasabi na ayaw ko nang magbuntis. So siguro pag-usapan natin yung permanent methods. So it will have to depend, one, on the need. Number two, yung characteristic nung mag-asawa. Let me give you an example. For example, short term. Sabihin natin na 1 year ko lang doktora, ayoko mag-baby next year. Bala ko nang mag-baby pag wala na yung, hindi na masyadong issue ang pandemic. So, 1 taon lang. So the options, of course, would be, ang short-acting will be oral contraceptive pills. It can be IUD, it can be injectable. Tapos nun, so ang maganda dito sa tatlo, reversible, yung tinatawag na reversible, ibig sabihin, pag ready na silang magbuntis, all you have to do is just stop. No? Just stop the pills or remove the IUD, and then balik na yung fertility. Yung mga long-acting naman, we're talking about 3 years onwards. So, ang pinakabago ngayon is the Implanon, or the implant, rather, wala na palang implant. So, here, yung arm. So, there is a very small device which is implanted, and ang visa nun is 3 years. Okay? So, maganda siya. Unang-una kaya dito kasi nakatago. Tapos, don't worry, hindi naman siya ganun kasakit mag-insert. IUD is also mga 5 years ang visa. Injectable is given every 3 months. Kanina, nabanggit ko na yung characteristic ng mag-asawa. It has to be taken into consideration. Kasi may mga babae na sasabihin, doktora, makakalimutin ako. So, pag ganon, huwag kang mag-prescribe ng pills kasi mabubuntis yan. Kasi pag nalimutan na ang pag-inom ng regular intake ng pills, pwedeng mabuntis, right? Ang pills kasi committed ka talaga na every day, you have to take all of your pills. Pag may nakaligta kang 2 or even 3, the failure comes in. So, anong ginagawa ko pag makakalimutin? Then I tell her, let's try the others. So, pwede tayong mag-IUD, pwede tayong mag-implant, pwede tayong mag-injectable. Okay. So, those are reversible. How about the long-term, non-reversible? Ito yung sterilization. So, pwedeng male, pwedeng female. So, in the male, it's vasectomy. Sa female, bilateral tubal ligation, or yung tinatawag sa Tagalog na tali, na tinatalian. Actually, ladies, hindi lang tinatalian yun, pinuputol din namin yung fallopian tubes para mas malaki yung chance of success. Okay. Nabanggit yung kanina that there are side effects. That's why this is also my advocacy. Please do not decide on the family planning method on your own. Kasi I'm really sorry and I'm really sad to know that oral contraceptive pills are sold over the counter. Hindi dapat. Kasi gamot pa din yan. May mga side effects pa din yan. Pag-usapan natin ang hiyang, that's fine. Pero kailangan rin natin pag-usapan yung possible side effects. At yon ay hindi nyo makukuha sa over-the-counter. You really have to ask a professional. Side effects like dizziness and anong tawag dito, mood swings, tapos changes in the reproductive tract. Tapos yung long-term side effects of pills, for example, changes sa kwelyo na pwedeng magdulot ng cancer in the end. So, kailangan napapag-usapan yun. Pati yung proper way of taking it. Kasi pag bumili lang po kayo over the counter na wala po kayong proper instruction, yung ibang pasyente iinumin whenever they need it, pagkatapos makakalimutan, tapos noon iinom na lang pagkailangan. So mali na yung paggamit. And then sasabihin nila hindi naman effective yung method na yun. Yun pala, mali lang yung paggamit. Okay? I think I would like to change, it's not really family planning, but I advocate for is reproductive health. Kasi health talaga ito ng babae, ng lalaki, at saka ng pamilya. So you take care of the entire family when you talk about reproductive health. Okay. In short, basically, it's a very long answer. Pero yun po ang kailangan kong ipayo. Number 1, you do your research and commit. Number 2, it has to be a combined commitment between the husband and the wife. Number 3, please consult a responsible physician who can explain to you advantages, disadvantages, side effects. Okay, Doc Dexter, then I'm done.
Thank you.
Thank you.
Thank you, Doc Titit. That's very good, no? Because you're able to highlight that it's very important for our health decisions to be done collaboratively. At that's something na sinusuportahan ng mabuti ng Commission on Population Development or POPCOM. That's what we champion in our government agency. And at the same time, we also advise, kagaya nga ng sabi ni Dr. Titit, na when you have questions, lalo dun sa mga different types of family planning methods, you get to ask, no? Kasi sa atin, magandang i-champion na panalo ang planado. Know what you're supposed to do so you can take care of yourself better. And speaking of which, we actually have 2 questions that came in through the Alaga Health inbox, no? And combo questions sila pareho. Ito, one from Miss Maria de los Santos. Ano po ang gamot para sa PCOS? Lagi na po akong kinakabahan kasi baka hindi po kami magkaroon ng baby ng asawa ko. 2 years po kaming married. Yan. Tapos may isa pa, combo din. It looks like it's a mental health and at the same time a reproductive health question. Normal lang po ba na ma-depress kapag ikaw ay nagpi-PMS? Nako, na magandang combo questions to. And buti na lang, sakto yung medical team na nandito to answer that question. So probably, to get her thoughts on this, probably we can ask Doc Joan. Dalawa yun, Doc.
Yes. Saan ako? Doon ako sa depression, ha? Tama ba yun?
Yes, Doc.
Normal ba na magkaka-symptoms of depression prior to menses, the start of menses? Yes, usually 1 to 2 weeks prior to the start of the menses, nagkakaroon po ang isang lady ng symptoms of mood changes, especially irritability. Kung napansin po rin nyo, parang madaling ma-irritable in the days prior to start ng menses. Irritability, some symptoms of depression, yung parang bagsak ang katawan, tiredness, exhaustion, parang madaling mapagod. So parang yung iba naman, hirap sa pagtulog. Meron din silang effect na gano'n. Or again, no, yung may mga cravings sila, bloatedness. So marami. Ang iba naman nagkaka-breakouts ng kanilang mga pimples. So yes, it can be a symptom of premenstrual symptoms sila. And be aware lang po na meron tayong tinatawag din na a more severe form of that is premenstrual dysphoria or premenstrual dysphoric disorder, which is more severe, medyo mas serious na ng symptoms of depression. But again, itong mga symptoms na ito ay usually naman after the start of menses, usually mga 3 days after, no, pag nag-start na ang menses, nawawala din sila. But kung nakikita po natin na may functional impairment na sa babae po, sa lady na nakakaranas ito, kung halimbawang nagkakaroon na ng problema in terms of sa trabaho, sa performance ng kanyang work, na absent na siya kasi talagang every month, talagang bagsak ang mood, hindi nakakabangon sa umaga, hindi nakakaligo, napapabayaan ng self-care, or because of the irritability and low mood, nakaka-conflicts na sa pamilya or sa kanyang mga katrabaho, or napapagalitan na ang mga anak. So, mas maganda po na i-consult also kasi meron po siya na it's again highly treatable, help is available at temporary lang po ito. So yes, meron tayong ganon na tinatawag premenstrual dysphoric disorder.
Thank you, Doc Joan. Siguro we can ask naman Doc Titit dun sa isa na kinakabahan na, mukhang nagkakaroon na ng mental health concerns also kasi kinakabahan. 2 years na daw, tapos wala pa daw sila, parang hindi sila nakakabuo ng baby at concerned siya dun sa PCOS niya. So any thoughts po, Doc Titit?
Alright. Clarify mo natin kung anong PCOS kasi a lot of people know PCOS. Ano mga ba yun? So, PCOS is a syndrome. Ang mga kasamahan niya would be, number 1, hindi nangingitlog. Okay? So, anovulation. In corollary to the anovulation, pwedeng irregular ang menstruation. So, I know of patients who minsan once a year lang nagre-regla. So, ganun ka-irregular. Number 2, may hyperandrogenism. So ladies, kung meron kayong mga symptoms, for example, if you have a lot of pimples, or kayo ay medyo nagpa-falling hair, or even so yung mga tinatawag natin virilizing signs, like for example, lumiliit ang suso nyo, yung mga ganun, or bumababa ang boses. So that's a more severe form of hyperandrogenism. And then of course, the insulin resistance. But let's talk about your concern, na sabi nyo, natatakot ka na baka hindi ka magbuntis. Basically, the reason na hindi nagbubuntis ang mga PCOS patients is that hindi nga nangingitlog. So yung sa medical term ovulation, di ba? Sa Tagalog, yung pangingitlog. Ang normal is that women would produce one mature egg per cycle, per month. Tapos no, that will be followed, pag hindi nabuntis, that will be followed by menstruation. Yun ang normal. In some cases na irregular ang cycles at may PCOS, you don't have an egg which is being formed. In other words, wala kang itlog na nagiging mature at nahihinog, which is now ready for fertilization. What you have in your ovaries are small eggs. Yun ang tinatawag na less than 1 cm. Maliliit sila. Marami silang maliliit na eggs. Pero not one of them will mature. Pag hindi nag-mature, walang ma-fertilize, then infertility becomes a problem later on. I'm really happy that you're asking this question now, na 2 years pa lang kayong kasal, tas you're still young, you're 28. Kasi the earlier that you consult an OBGYN regarding your problems, nagagawan po ng paraan ang PCOS. Okay, meron pong mga gamot for it. Meron pong gamot na pampaitlog para kayo po ay mabuntis. So, medyo long conversation po yan with your OBGYN. So, I suggest that if you're really ready now to become pregnant, then go visit now an OBGYN. Sabi nung iba na magpaalaga na po kayo. Okay, Dr. Dex?
Love the segue, Dr. Titit.
To add lang, Dr. Dex.
Sige po.
Oo,
yes, Doc.
yes, sa ano naman, no, sa mental health aspect naman, di ba, Doc Titit, yung mga may PCOS po, no, they're also at increased risk for having symptoms also of mood changes, anxiety. So, mas maganda also po. Kaya always nagko-collaborate po talaga ang psychiatry and OB. Lalo na kung may mga patients po no, na diagnosed with PCOS kasi mataas ang risk nila para magka-develop ng simptomas ng lungkot, anxiety, pangamba, takot. Especially nga about the ability nila to bear a child, etc. So early intervention pa rin po ang mas maganda. Kaya lagi pong nagko-collaborate lagi. Mas maganda pa rin po early intervention para hindi po maagapan kaagad kung may mga simptomas po nitong mga mental health concerns.
Yan. Thank you very much.
May psychological effect yung the fact that you're trying to get pregnant, tas you fail every month, ay ang hirap nun. Kaya yes, doktora, talagang magre-refer ako ng mga pasyente sa'yo, yung mga medyo nadidepress na gustong-gustong magkaanak, hindi naman magka-baby. Meron talagang psychological effect. I agree.
Perfect. Thank you, mga doc, no? At for sure, si Sir Boyet, nagno-notes. Nako, Dex, sama natin sa mga programs natin, mental health and reproductive health. Pag-usapan natin sa board meeting. But for sure, that's something that we want to highlight and champion, no? And we actually have a couple of questions here pa. Mukhang primary care tong tanong na ito. Kasi ito ay coming from Ma'am Mary Ann Ominga. Na-diagnose daw siya ng hypertension stage 2 at peripheral neuropathy. Ang gamot daw niya ay pregabalin at yung mga maintenance niya for hypertension. Tinatanong lang daw niya kung itutuloy pa daw dapat yung losartan at amlodipine always, every day. Yon, tanong daw niya. God bless and good evening daw sa atin. So, Doc Via, na-diagnose na daw siya before. Ang tanong niya, kasi yung mga pasyente, minsan ang dami-dami na daw nilang gamot. Ang tanong nila, dapat ko pa bang inumin lahat ng to? Lalo na pag sinabing maintenance yung gamot? Perfect.
All right, no? That's actually a very common question, no? Maybe siguro I'll jump into that after I'll segue from PCOS. So, maganda na, Doc Dex, you were actually able to propose, no, especially to our government agencies and POPCOM, yung PCOS or your reproductive health, because a lot of people have. And I also have, so it's very relatable. No? So it's very important the partnership between the medical specialist and the government is being forged for us to be able to give care doon para maalagaan natin ang ating mga pasyente, ang ating mga pamilya, no? And speaking of pangangalaga sa ating pamilya, marami sa ating mga parents, no, and lolas have hypertension, and common nilang tinatanong na Doktora, normal naman yung BP ko. Kailangan ba talagang inumin ko pa to? Do I still have to continue drinking that? The answer po is yes. Kaya natin siyang tinatawag na maintenance because it maintains yung ating ang paggana po ng katawan natin. Kasi when we get older, para tayong mga makina we have, yung mga systems natin ay nag-undergo ng wear and tear na tinatawag, no? So that is why it's important for us to be able to maintain, to take our maintenance medications every day kahit normal pa po yung blood pressure natin. Kasi iniiwasan po natin, number one, na lumala po yung hypertension natin because pag lumala yung hypertension natin, ito ay maaaring mag-result sa maraming complications such as heart diseases, no? Kidney disease or yung tinatawag nating stroke, no? So it's important for us to be able to take that every day and wala po tayong absent doon. Important na palalahanan natin hindi lamang yung ating mga sarili kundi yung mga magulang natin, yung mga lolo natin na kahit na normal pa yung BP natin, kailangan natin pa rin uminom every day as part of our daily regimen because it's part of us taking care of our health as well.
Perfect. Thank you for that, Doc Viano. So, ang ganda ng usapan natin thus far and I'm really very happy na ang engaging ng ating mga commenters and mga viewers ngayong gabi. But before we go any further, I think it might be time for a quick detour for our quick Alaga Health's Alagang Hello, Doctor. Yan. So, as mentioned before, Alaga Health is partnered with Hello Doctor. It's part of the Hello Health group that's present in over 9 countries. We're very happy that there are partners. And ang maganda, we are sharing some of their wonderful content even on the Alaga Health platform. And I'll show you some of their great articles right here, right now. No? So here, we can go to the hellodoctor.com.ph website. And since Population Day ang ating pinag-uusapan ngayon, pag-usapan natin ang importance ng family planning. So this one was written by Ma'am Flor Angeline Quesada and medically reviewed by the Hello Doctor Medical Panel. Kasama kami nila Doc Via dyan. And if you can see, di-discuss dito yung mga issues and concerns about family planning. Ang maganda, they even have these wonderful publication materials or mga PubMats, no, about the benefits of family planning. So, ang ganda dito, Boyet, kasi may mga kasangga tayo in terms of spreading more information about family planning, do's and don'ts, etc. And why is it important for women, for men, for the child. Ang ganda kasi very holistic and ang ganda dito, sinama pa nila yung buong family. So this article actually lists even the different contraceptive methods and some tips, no? Your age, your mind. Ang ganda, very comprehensive and it's very, very quick and cool. So if that's going to be the case, I hope you can visit hellodoctor.com.ph. There are partners and friends and they are allied with Alaga Health. So pagdating sa healthcare information, you go here, Hello Doctor. But pagdating naman sa health services, kami naman dito sa Alaga Health. So that's all for Alagang Hello Doctor. Now, it looks like time has flown by once again, no? Hindi ko na naman napansin yung oras. Ang bilis lang talaga. But we're very happy na ang dami nating nasagot ng mga tanong today. And I think even those that are commenting on our feed and those who sent in their messages sa ating inbox, very happy. So, with that being the case, maybe it's time for Alaga Health's wrap-up. Perfect. So, today we talk about World Population Day, reproductive health, sexual health, mental health, and everything under the sun. No? So, perhaps we can get some final tips from the likes of Via to kick things off.
Alright, no? So natapos na naman ang isang napaka-informative very insightful Alaga Health Live, no? And I would like to thank our guests, Sir Boyet, Doc Joan, and of course, Doc Titit, no? Doc Joan and Doc Titit are our mentors from med school. So it was really very daunting, but it was fun, no? Being here right now, no? And of course, kahit na even beyond the walls of the med school, of the grounds of our med school, they're still there to guide us, no? So and nandyan pa rin sila para alagaan tayo, no? So and that is why it's very important, no, for us to be able to give care, no, not only for ourselves, no, because we are the workhorse of the population. No? So we're talking about World Population Day. Kailangan nating pangalagaan ng ating sarili dahil tayong bumubuo ng ating mga pamilya, ng ating komunidad. No? And health is always work of a community. No? So in taking care of ourselves, kapag napangalagaan natin ang ating sarili, napangangalagaan rin natin ang ating mga mahal sa buhay, ang ating pamilya. And nandyan po ang Alaga Health at of course ang ating mga specialist, ang ating mga doktor para sagutin po ang inyong mga katanungan at matugunan po ang inyong mga pangangailangan sa inyong kalusugan. Muli maraming salamat po at magkita-kita tayo next time for another Alaga Health Live.
All right. Thank you very much, Doc Via. No? And special shout out to our other partners, the Philippine Alliance of Patient Organizations, Healthy Philippines Alliance, and so many more. And to kick things off, this wrap up, perhaps we can segue to Doc Joan, especially na ang dami nating tanong tungkol sa mental health tonight.
Yes. Again, maraming salamat po, Alaga Health Team, Dr. Dex, Dr. Via, for inviting me. Always my pleasure to join you every time. And again, there is no health without mental health. Lalo na no, sa usapang population, we know that mental health is very important in having or in achieving a very mentally healthy and functional ng mga members ng community. Kasama kasi doon ang functionality of each and every member ng community because the future of any country lies not just with the individual but with the entire community. So maraming salamat po.
Thank you very much, Doc Joan. Always a pleasure to have you with us. And she's a first-timer here in Alaga, and hopefully she will join us again in the future, no? Ang ganda ng mga responses ni Doc Titit. Any last words or probably anything that you would like to promote or invite our viewers to?
Dr. Dex and Dr. Via, first of all, thank you for the invitation. Okay, actually, nagulat ako sa invite ni Via, but of course, I said yes right away. Kasi I know na napakaganda ng objective nitong group na to. So, I agree with Dr. Joan that health, doctors naman take care not only of the body, but doctors are supposed to take care of everything around the person. So, holistic talaga. So including not only reproductive, which we talk about tonight, but mental health as well. Health of the family, health of the community, I agree, kailangan po natin yan. So once again, thank you very much for the invite. It is an honor for me to be here. Dex and Via, thank you.
Thank you very much, Dr. It's a pleasure to have you with us tonight. And of course, last but not the least, no, we're very excited to hear his final words. We heard a while ago from USEC GP Perez. And we're very excited also because firmado na po ang EO 141 and it's something that we will be hotly campaigning for over the next few months, and we'll be working with our advocacy partners and our fellow partners in the medical field. So, any final words, D.E.D. Boyet?
Yeah, salamat Comdex at ako'y natutuwa dito sa mga tanong ng ating mga nakikinig ngayon kasi parang na-highlight yung isa sa mga hindi napag-uusapan actually sa family planning, which is yung issue ng infertility, o yung kagustuhang magkaanak, kasi usually pag pinag-usapan ng family planning, ang laging is yung pigil or di kaya pag-regulate natin ng ating fertility. Pero ang family planning actually is kakayahan natin to achieve yung ating fertility intention, and that includes yung kagustuhan natin magkaanak. So yung reproductive health services ng gobyerno actually covers also yung mga assistance and other support doon sa mga mag-asawa na gustong magkaanak, hindi lamang yung sa family planning. And actually, yung mga family planning methods natin, some of them are, lalo na yung mga natural methods natin, can also provide, assist us in the attainment of our fertility actually. No, so yun yung maganda no na na-highlight yon because sabi ko nga madalang na mapag-usapan yon, and the overall concept of reproductive health focusing also on the mental health is also very important. That's why within the perspective ng World Population Day, ang ganda ng ating ng mga development na nangyayari, because it highlights actually yung the entire sexual and reproductive health ng mga kababaihan at ng mga kalalakihan. And we're very glad nga to report that the government has again step up, lalo na ang ating executive department through President Rodrigo Duterte in the passage in the issuance of Executive Order number 141, which now calls declared the measures of addressing the root causes of teenage pregnancy as a national priority, which calls all the entire government to take action. So meron na tayong mandato lahat na yon, and pinagtrabahuhan natin yon, and at least it provides us the platform for a more enabling environment for all key stakeholders to take action. Kaya yun yung isang naatasan na naman na gagawin sa Commission on Population to really consolidate all efforts towards the reduction of teenage pregnancy. So as a final message siguro, while we observe yung World Population Day bukas na July 11, it's once more a reminder for all of us na bawat isa sa atin ay may karapatan for our sexual and reproductive health. Kaya dapat sumangguni tayo, mag-usap tayo, ugaliin natin mag-usap patungkol sa ating fertility sa mag-asawa, and sa mga kabataan naman ay dapat pa rin yung kanilang decision whenever they express yung kanilang mga sexuality. So all of those are covered by the World Population Day na sineselebrate natin ngayon. Thank you. Thank you once more, Comdex, for the opportunity.
Thank you very much, D.E.D. Boyet. And of course, invite din namin kayo to like the Alaga Health Facebook page para updated kayo kapag tayo ay mag-Alaga Health Live na. And since it's World Population Day, invite din namin kayo to like the official POPCOM Facebook page, which is facebook.com/officialpopcom. So, with that being said, lumibas na naman talaga ang isang oras ng napakabilis. And we've come to the end of our show. Kita-kita po ulit tayo sa susunod na Sabado para na naman po sa isa na namang oras ng libreng konsultasyon at masayang kwentuhan dito lamang po sa Alaga Health Live. At next week sa lahat po na merong iniindang sakit sa katawan, sakit sa buto, hirap tumayo, hirap gumalaw, we will be celebrating National Disability Prevention and Rehabilitation Week. May mental health component din dyan at napakarami pang iba. So, you wouldn't want to miss that. We will see you all here next week. And muli, ako po si Doc Dex Galban na nagpapalalang alagaan ng kalusugan para mas umunlad ang ating bayan. Ito po ang Alaga Health. Magandang gabi po!
Magandang gabi!